Hi, I'm Dr. Lizi. You can sit right there. How can I help you? Okay. Well, before we start, can I ask you a few questions? Okay. I will need your name, last name. Thank you. Okay, can you tell me since when you have difficulty to fall asleep? Okay. And can you tell me for your sleep last? Is it 3 hours, 4 hours? You're not, I mean, you do sleep, right? Okay, so tell me I'm sorry, I couldn't ask my question correctly. For how long your sleep last? That's I suppose how I should ask. Okay. Do you have strange dreams as well? Okay. Well, are you on any new medication because it can affect your sleep routine? Okay, so you didn't been getting any. Okay. Sorry. Well, I suppose I can do something for you, but you know, it's not going to help you permanent. It will help you only once while we are doing examination, and I believe we can perform a cranial nerve exam just to make you relax, and you might fall asleep after that. Okay, but it won't help you in the long term. That's what I said before. At least you can take a good rest. In the meantime, we'll figure out how we can help. Okay? Okay. So, other than having difficulty to fall asleep, is there anything else that I should be aware of? Okay, so you don't think you have any problem? Let me put my computer a little bit further from us. That should be okay. So you don't have any problem with your hearing, with your vision? Look at my finger. Okay, are you staying alert all the time? Are you feeling stressed? Other than tired, sleepless? Okay. Let's see. Okay. I would like to look into your eyes. Just keep looking straight for me. Okay, that would be great if you just focus on my voice and nothing else. Try not to think about anything else other than examination right now. Okay? And if it will make you feel better, you do this examination not because there's something wrong with you. You're doing this examination just to make sure you have a good sleep and relaxation in the end, okay? Great. Okay, I'm going to close your ear with my hands and I'll whisper to tell me if you hear it. Okay, what about this time? Okay, and I would like to make sure that you heard me. I'm going to whisper. You heard that? Okay. 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 Focus on my nose, please. On my nose. Okay. I want you to look at this balloon. Try to follow it. Okay, follow it. Follow it. Now look at my finger. Now look at balloon. Look at my finger at the balloon. Look at my finger at the balloon. Okay. Open your mouth, please. Okay. I want you to close and open your eyes for me. Close, open, close, open. Okay. I want you to relax your face. I'm just gonna tap, 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 tap. Okay, I'm going to tap now, and I want you to tell me where you feel the tap. Okay. Where you feel the tap. Okay. What about now? Okay. Where do you feel it? Okay. Where do you feel it? Okay. Where do you feel it? What about now? Okay, I'm going to close your right eye. You keep your eyes open. I'm gonna close it with my hand. Whenever you see my finger appear in your vision, I want you to let me know. Okay, that was great. I'm going to close your left eye. Whenever you see my finger appears in your vision, let me know, okay? I'm going to close your upper vision. Keep your eyes open, okay? Whenever you see my finger appear, you let me know. Okay, I'm going to close your lower vision. Okay, keep your eyes open. Whenever you see my finger appear, you let me know. Okay. Okay, I'm going to just follow the tool. Follow. Don't follow. Follow. Okay. As we did before, I'm going to close your right eye. You just follow the tool for me. Okay, follow. Follow. Okay, I'm going to close your left eye. You follow the tool. Okay, I'm going to bring it a bit closer to your eye. At some point it will get a bit blurred. I want you to let me know. Okay. When it gets blurred, you let me know. Okay. When it gets blurred. When it gets blurred. Okay. Try to relax your head, your face. Try not to move your head around. Keep it still, but relax at the same time. I'm going to give a little pressure right here between your eyebrows. At the same time, I want you to look at my finger. Whenever my finger do this move, I want you to let me know, okay? Just look at my finger. Oh, good. Okay, I'm gonna give a bit more pressure. Are you doing fine? Okay. Don't forget to let me know. Okay, I'm gonna give a bit more pressure now. You tell me whenever my finger moves like that. Okay, good. Now I'm gonna give a little pressure somewhere right here, okay? And that's supposed to make you feel good, okay? So if it's other than good, you let me know, okay? Now let's start with your right side. I'm gonna give a little pressure right here. Are you okay? the same time, you look at my finger. Whenever my finger do that, you let me know. Okay. I'm gonna give a little bit more pressure, just so you know. Try to, I know it's a bit difficult to keep your head still. Okay. Well, you're doing great. Now I'm going to go to your left, give a little pressure there. And you know it's gonna be next. Yeah. Okay, whenever. That's right. Whenever. Okay, that was extra. I'm sorry. Okay, I'm gonna give a bit more pressure. Are you doing fine? Okay. 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 Can you please poke your cheeks out and look at my hammer? Poke your cheeks out, look at my hammer. Okay, relax your cheeks. Open your mouth. Close your mouth. Can you raise your eyebrows? Okay, relax them. Raise your eyebrows for me. One more time. Okay, relax them. Now we're going to do the same thing, but you don't need to look at the hammer anymore. Raise your eyebrows for me. Keep them there. I'll try to pull them down, but don't let me do that. Okay, great. You can relax. Can you move your cheeks out? I'll try to pop them, but don't let me do that, okay? Okay. Open your mouth. Yeah, and keep it open. I'll try to close it, but don't let me do that. Yeah, you can relax now. Okay. Well, I do have one question about your peripheral vision. Do you have any problem with that? Okay. Are you ever get some blinks or I don't know, any problem with your peripheral vision whenever you look to the right? Only with your eyes, not turning your head. Okay, so let's see. Let's check it one more time. I'm going to be focusing on your right eye right now. Okay. Okay, I want you to focus on my nose. And the focus point will change. Now, can you look at this eyebrow? You open this one. Can you look at this one? And this is not lucky one. That's fine. I'm okay. Can you look at the forehead? Okay. And can you look at my chin? Okay. Now I'm gonna get a bit brighter light. Hopefully it will work. Can you please focus on this eyebrow for me? Okay, can you look at this eyebrow? Can you look at my nose? Can you look at my forehead? That's right. Now look at the chin. Okay. So as I said, let's check your peripheral vision. Okay. I want you to focus at my nose right now. Or if you're tired of my nose, that's fine. We can choose any other part. Sorry, we can choose any other part on my face. Okay? I mean, you can choose. And I will be standing right here. Okay, and at your right peripheral vision, you'll see some colors. Let's see if you'll be able to tell me. Okay, color number 1. You look at me. Okay. Color number 2. Okay. You look at me. How about eyes? Okay. Number 4. Okay. Color number 5. Okay. And color number 6. Okay. And color number 7. Okay. Let's I'm going to be standing right here. Yeah. Color number 1. Okay. Color number 2. Color number 3. Okay. Color number 4. Color number 5. Color number 6. Color number 7. Okay. I want you to trace the black line with me. Okay, I'm going to help you do that. Just trace it from here to there. Here we go. Just follow the stick. Okay. How to make it secured. Okay. Okay, now I want you to focus on the sound and only. Okay. Let's examine your hearing. I'm sure there's no problem, but there's always but. So, focus on the sound. Yep, you hear it from the right and from the left. Wonderful. At some point, either on the right side or either on the left side, sound will stop. Now, I want you to let me know which side was that. Okay? Right. What about now? Okay. Let's try one more time. Okay, that's good. Okay, let's go with something thinner. Let's see, focus on the sound only and tell me whenever it stops. not to look at the light, just find a focus point. That's fine, yeah. Perfect. Okay. I actually forgot something. Let's try with this. Okay. I'll have a little remote control. Now I'll be pressing the buttons all around you, okay? Whenever you hear me pressing the button, just let me know that you heard it. It can be, you know, not to talk much if you don't want to. That's fine. Just let me know that you heard it, okay? Let's start, and I'm just gonna chill around, you know. Okay. Okay. Very nice done. Put it back. Okay. Now give me your pupils. Let's see. Have you ever had problem looking at the bright light? You know, sometimes your eyes start running, or it takes time for you to, to be okay on the light. Especially, it's like, imagine you're sitting in a dark room, look at the hammer, and then you're, at some point, you have to go out, and there's a super bright sun. Sometimes it takes time to get used to that sun. Okay. Sometimes you feel like that even without bright light. Do you understand what I'm asking? I mean, if you don't, that's okay. I didn't even understand what I asked. Have you ever been affected by a very bright light? Okay. That's right. Okay, well, yes, my next step will be pointing a very bright light to your eye. I'm sorry, that's part of it. Okay. I'm going to show you pictures, and I want you to tell me whatever you see, okay? Whatever you see. Okay. Whatever you see. Okay. Okay, relax your body. little bit this way. Okay. Okay. And this might look scary. This looks like a very scary needle, but actually, look, it's not sharp at all. Okay, it will feel like this. So I'm just gonna go right here. Do you feel it? Okay, can you tell me exactly where do you feel it? Okay, you're not afraid anymore, right, of needles? See, they're not sharp at all. Okay, you tell me, where do you feel it? Okay. You felt it? Okay. Did you feel that? I maybe didn't touch it. Okay. Did you feel that? Okay. Okay. This is a very tiny brush. Give me your arm. So, tell me if you feel it. Okay. Okay, now tell me exactly where you felt it. And on your left. Good, my friend. You did very good. I'm going to close your right eye, and with your right hand, I want you to touch my nose. Okay, I'm going to close your left eye. With your left hand, I want you to touch the tip of my nose. Okay, I'm going to close your right eye, and with your right hand, I want you to touch my right eyebrow. Okay, and with your left hand, I want you to touch my left eyebrow. Okay, now I want you to focus on my hand. Focus on my hand. You see, where is it? I'm going to close your eyes right now. Can you give me a high five? Okay. To focus on my hand. Do you remember where my hand? I'm going to close your eyes and give me a high five. I mean, please not to my face, okay? Thank you. That was great. I want you to look at my finger. Look at that finger. Okay, look at the finger. Now look at the finger that's moving. Okay, look at my finger. Now at the finger that moves. Okay, look at my finger. Now at the finger that moves. Okay. guess I can finish this a bit later. And I'm gonna get my office to you. Okay? So you'll have your nap as long as you need. You're my last patient. Anyway. Here we go. Okay? I mean, if you need mask, there's one right here. You can use it, okay? And I can fill you in about your cranial exam a bit later. Don't want to ruin your atmosphere, okay? So I'm happy that I helped you, but we will talk about your cranial nerves a bit later, okay? Now have a good sleep. You already look a bit, yeah, I mean, you want me to go away, okay? I'm sorry, but